You probably never say this out loud, right? Not at the kopitiam with your car keys, not at the golf course, not even to your wife of 40 years. But this question, it has been sitting quietly at the back of your mind for decades. Sometimes since you were a young NSF, sometimes even longer. Am I normal? Is my size okay? I am Dr. Natalie Teo, urologist and sexual health specialist with more than 30 years of experience here in Singapore. And today we are going to talk about one of the most common questions in men's health, but also one of the least discussed openly, the size of the penis. We are going to separate the myth from the science, the fantasy from the biology, the insecurity from the truth. Because millions of men, including many uncles and pecs right here in Singapore, carry silent doubts that were never even theirs to begin with. You see, penis size is not just a curiosity. For many men, especially those of you in your 50s, 60s and beyond, it is a source of intimate anxiety. It affects confidence, it impacts intimacy with your partner, and it slowly chips away at self-esteem. Some of you have been married for decades, got children, got grandchildren even, but still this worry sits there quietly. And yet, what does the science actually say? According to a worldwide study of more than 15,000 men published in the British Journal of Urology International, over 90% of men fall within a perfectly normal range. Let me say that again because I want you to really hear this. More than 90% of men are normal. So why do so many men still feel inadequate? Why do I still see patients in my clinic at Mount Elizabeth, gentlemen in their 60s and 70s, still asking me this question with shame in their eyes? It all starts very early. Imagine you are 13 or 14 years old back in the 1970s or 80s. Maybe you found your father's magazine or your friend showed you something at school. You saw something and you did not realize that what you were looking at was not biology but performance. The man in that image was not chosen randomly. He was selected specifically for his size, for the camera angles, for the shock effect, often even digitally enhanced nowadays, lit professionally and edited to maximize impact. But that image became your reference point and it stuck deep inside your mind for the next 50, 60 years. Add to that the army talk during NS, the bravado in the bunk, the crude comparisons in the shower, and suddenly a totally average body started to seem inadequate. The studies show that up to 60% of men feel some form of dissatisfaction with their size, even though more than 95% are actually within the medical norm. And here is the thing that might surprise you. When researchers actually ask women what matters to them in a partner, only 5 to 10% say that size is very important. Only 5 to 10% lah. So where does this obsession come from? Because nobody ever told you the truth. Not in school, not during your NS medical checkup, not from your father, and certainly not on the internet. Instead, we were given myths, false comparisons, and a big silence. Let us change that right now, shall we? So what is the actual average size of a penis? And just as important, how do you measure it properly? Here is the surprising twist that I tell all my patients. Most men measure wrongly. It is like using a broken weighing scale. No matter how many times you check, you will never get the truth. Some men place the ruler too far forward, others start from the skin instead of the pubic bone, others measure from underneath, adding centimeters that do not reflect real anatomy. Some do not measure during full erection, some compare when they are cold, anxious, or barely aroused. In medical research, we use a method called the stretched penile length at rest, and it is remarkably reliable. Here is how to do it properly, and I have taught this to thousands of patients over my 30 years of practice. Stand up straight, take a ruler or a soft measuring tape, place it on top of the penis, starting from the pubic bone, pressing slightly into the fat pad for accuracy. While the penis is flaccid, gently stretch it forward to its natural maximum length. Firmly, but without forcing. Measure from the base to the tip. This is your stretch length at rest, and it very closely reflects your erect length. For circumference, also called girth, use a soft measuring tape or a simple string. Wrap it around the thickest part of the shaft, mark where it meets, then measure that length. There you go. You now have an accurate medical measurement. I always tell my patients, do this properly one time, write down the number, and then you can stop worrying. Now that you know how to measure correctly, here is what the real data shows. A landmark study from 2015, the largest ever conducted, analyzed nearly 15,000 men from around the world, including data from Asian populations. The results show that the average erect length is 13.2 centimeters, which is just over 5 inches. The average erect circumference is 11.6 centimeters, roughly 4.5 inches around, not 20 centimeters, not 25, not what you saw in that video your colleague showed you, just slightly over 13 centimeters in length. And that is the global average. Now, I know some of you are thinking, but Dr. Teo, what about Asian men specifically? This is a question I get asked all the time in my clinic. Let me be very clear with you. The differences between ethnic groups are much smaller than most people think. We are talking about maybe half a centimeter to 1 centimeter difference in averages. The variation within any ethnic group is actually much larger than the variation between groups. So please do not let anyone make you feel inferior because of your race. That is just not supported by the science. Even more important, 95% of men fall between 10 and 16.5 centimeters. That is between 4 and 6.3 inches. If you are within this range, you are not below average. You are not lacking. You are, by every medical and scientific standard, perfectly normal. I have examined thousands of men in my career, Singaporean men, Malaysian men, men from all over Asia and beyond. Trust me when I say that normal covers a very wide range. And what about the extremes? On one end, we have the medical definition of micropenis, which is less than 7.5 centimeters or about 3 inches when stretched or erect. This is a genuine medical condition that affects less than 1% of men, and yes, there are treatments available. I have helped many patients with this condition over the years. On the other extreme is megalopenis, anything above 24 centimeters or 9.5 inches. These are extremely rare genetic cases, not references for masculinity, not goals to achieve. And yet most men do not actually fall outside the average. They only believe they do because perception is not reality. When you compare yourself to fantasy, you always lose. The actors in adult films do not represent the average man. They are selected for one exaggerated characteristic, and even then, the illusion is amplified by camera angles, lighting, silicone prosthetics, and sometimes even digital enlargement. A 2016 survey revealed that some adult scenes are digitally modified after filming to increase apparent size. This is not just exaggerated, it is fabricated lah. But your brain does not see the editing, it only sees bigger, and somewhere deep down, you start to believe you are smaller. I have had patients tell me they felt inadequate their whole lives only to find out during examination that they are completely 100% normal. The relief on their faces, I cannot describe it to you. Worse still, many men compare themselves in the mirror while flaccid in an air-conditioned room or under stress. The penis is extremely sensitive to temperature, anxiety, and blood flow. A simple chill or passing tension can reduce it by half. Compare that to someone fully aroused under professional lighting with digital enhancements, and the comparison becomes ridiculous. But that ridiculousness transforms into insecurity, insecurity into anxiety, and anxiety spreads into relationships, confidence, and self-esteem. For you gentlemen who are getting older, there is another factor to consider. As we age, the penis can appear to shrink slightly. This is often due to reduced blood flow, weight gain around the abdomen, or changes in the pelvic floor muscles. But here is the good news. Much of this is reversible or manageable. I see it all the time in my practice. Men in their 60s and 70s who make some lifestyle changes and suddenly feel like they are 40 again. And yet none of this anxiety is rooted in biology. This is not science, it is distortion. A study from the UCLA Department of Urology showed that the majority of men seeking enlargement surgery already had normal size, and after the operation, 40% remained dissatisfied. Many of these procedures carry serious risks, especially when they are not medically necessary. And beyond a certain point, between 15 and 18 centimeters, more size does not mean more satisfaction. In fact, it can even cause discomfort or pain for your partner. So what actually works? Let me share with you the real tools to improve your appearance, your sensation, and your performance. These are things I have recommended to patients for 3 decades, and I have seen real results. Tool number 1 is reducing fat around the pubic area. When abdominal fat increases, the penis appears shorter. Not because it shrinks, but because it gets buried in the fat pad. This is especially common for Singaporean men as we get older, especially with our love for Char Kway Teow and chicken rice, right? Studies show that losing just 5 centimeters of your waistline can add up to 1.5 centimeters of visible length. That is right. You do not need surgery. You need to cut down on the mee goreng and start walking more. Take the stairs instead of the lift at the HDB. Walk to the MRT station. Small changes, big results. Tool number 2 is improving blood circulation. Your penis is a vascular organ, not a muscle. More blood means more firmness, better erections, better sensation. Eat foods rich in nitrates like beetroot, spinach, and leafy greens. You can find all of this at the wet market or NTUC. Add L-citrulline or L-arginine supplements, but always under medical supervision. Please come see me or your own doctor before starting any supplements. Stay well hydrated. In Singapore's heat, this is especially important. Stop smoking. I cannot stress this enough. Smoking destroys your blood vessels and your penis depends entirely on good blood flow. And yes, do pelvic floor exercises. Kegels are not just for women. They strengthen the muscles that control blood flow, rigidity, and control. I teach my male patients how to do these exercises, and many of them report significant improvements within a few months. You can do them anywhere, sitting at the hawker center, waiting for the bus, watching TV at home. Nobody will know. Tool number 3 is monitoring your hormones. Testosterone is your biological fuel. It influences mood, libido, circulation, and your entire vitality. When the testosterone drops, which naturally happens as we age, nocturnal erections decrease and tissues become less responsive. This can change both your performance and even your appearance. Ask your doctor for a complete hormonal panel, test total testosterone, free testosterone, SHBG, and estradiol. And if your levels are low, start with natural solutions. Better sleep, which I know is hard in Singapore with the noise and the stress, but try. Heavy resistance training, more zinc from foods like oysters and pumpkin seeds, less alcohol. And if needed, explore medical options, always under supervision. Tool number 4 is to stop comparing and start connecting. You are not a number. You are not a measurement. You are not a ruler on a screen. What satisfies a partner is not length. It is connection, confidence, and presence. I have spoken to many women over my career, wives of my patients, and I can tell you that what they care about is intimacy, attention, and feeling desired, not centimeters. For those of you who have been married for many years, maybe the spark has dimmed a bit. That is normal. But it has nothing to do with size. It has to do with routine, stress, health issues, and sometimes just forgetting to prioritize each other. Work on your relationship, talk to your partner, be present. These things matter infinitely more than any measurement. Tool number 5 is to seek real solutions and real advice. If you are considering enlargement surgery, stop for a moment. Ask yourself honestly, am I doing this because something is actually broken or simply because I never learned the truth? If the answer is emotional, talk to a therapist first, not a cosmetic clinic. Because body dysmorphia is real and the damage when you act without addressing the root cause can be permanent. I have seen men spend tens of thousands of dollars on procedures that did not make them any happier. Some even ended up with complications. Please do not let insecurity drive you to make decisions you might regret. Come talk to a proper medical professional first. Now, let me address something that came up in some of the questions I have received. What about men with micropenis? Is there help available? The answer is yes. If you genuinely have a micropenis, which again is less than 7.5 centimeters when stretched, there are medical and surgical options available. Hormone therapy, if started early in life, can help. There are also surgical procedures that can provide some improvement. But these decisions should be made carefully with proper medical evaluation, not based on insecurity, but based on genuine medical need. If you think you might have this condition, please do not suffer in silence. Come see a urologist. We have seen everything, we will not judge you, and we can discuss what options might be suitable for your specific situation. There is no shame in seeking help. Another question I often get is whether size affects sexual satisfaction for your partner. Let me be very direct with you. For vaginal intercourse, the average vaginal canal is only about 10 to 12 centimeters deep when aroused. Most of the nerve endings that create pleasure are located in the first few centimeters near the entrance. This means that average size is more than sufficient for mutual satisfaction. In fact, too much length can cause discomfort by hitting the cervix, which is not pleasant at all for the woman. What matters much more is technique, communication, and making sure your partner is properly aroused before penetration. Foreplay is not optional, it is essential. Learn what your partner enjoys, ask questions, pay attention to responses. This will improve your intimate life far more than any extra centimeter ever could. For those of you dealing with erectile difficulties, which becomes more common as we age, please know that this is a separate issue from size. Erectile dysfunction affects up to 50% of men over 50 to some degree. It is usually related to blood flow, hormones, medications, or psychological factors. It is very treatable. Do not let embarrassment stop you from seeking help. We have excellent treatments available now, from medications to devices to therapy. Your intimate life does not have to end at any age. The truth is that you may already have what you have been looking for all along: normality. The majority of men are well within the normal range, and this is not a consolation prize, it is reality. I have examined thousands of men, and I can tell you that the ones who are happiest with their intimate lives are not the ones with the biggest measurements. They are the ones who have accepted themselves, taken care of their health, and invested in their relationships. So what is the real takeaway from all of this? You are not your measurement, you are your mindset. The power is not in changing your body, but in understanding, respecting, and optimizing it. When you stop obsessing over size, you can finally focus on health. And when you do that, everything improves: your performance, your confidence, your relationships, your overall quality of life. Let me ask you this. What is more powerful, being above average on a ruler, or being in control of your body, your mind, and your life? You already know the answer. I have been practicing medicine in Singapore for over 30 years now, and I have seen thousands of patients. The happiest men are not the ones chasing some impossible standard. They are the ones who have made peace with themselves and focus on what truly matters. Now, I want you to do one last thing. If you have a question, leave it in the comments below. I will answer as many as I can, and I will keep everything anonymous. Subscribe if you want more truth and less noise. And if this video has helped you, share it with someone who might need to hear this: your friend, your colleague, maybe even your son, because you never know who is carrying the same silent question that you have carried for decades. You are never too small. You are simply never told the truth until now. For those of you here in Singapore, if you want to discuss any of these issues in person, you can always book an appointment with a urologist. We are here to help, not to judge. Take care of yourselves, gentlemen. Your health, your confidence, and your happiness are worth investing in at any age.